Calvin Jones, a grown man built like a Teletubby. It is said he has the emotional intelligence of a wet fish. This man thought the best way to handle a toddler was to get his shoes and use them. His sneakers no less. Basketball sneakers. Air Jordans in fact. He really turned into a full-blown executioner over potty training. Today I'm covering the devastating death of 2-year-old Saniyah Kuykendall. But before we begin, I want to warn you, this case involves graphic details about child abuse and death. I'm going to try as much as I can to stay within YouTube's guidelines. If you're sensitive to these topics, please keep this in mind. Our story centers around 3 main people. First, there's Saniyah, a vibrant 2-year-old girl who should have had her whole life ahead of her. Then we have her mother, Anisha Alford, a woman whose decisions would ultimately contribute to her daughter's death. Finally, Mr. Teletubby, we have Calvin Jones, Anisha's boyfriend, and the man who would become the primary perpetrator in this horrific case. Calvin Jones was not Saniyah's biological father, but he lived with Anisha and her 3 children in their Memphis apartment. And by all accounts from neighbors and acquaintances, Jones presented himself as a quiet, peaceful man who regularly attended church. But as we'll see, this facade would crumble under the weight of evidence that revealed a much darker truth. Anisha Alford was a working mother trying to make ends meet. She worked at Walmart and relied on others for transportation, including Calvin. She had 3 children from previous relationships, with Saniyah being the youngest at just 2 years old. The family lived together in what appeared to be a typical house, but beneath the surface, something sinister was brewing. So on May the 14th, 2010, the day started like any other day for the family. Saniyah and her brothers were dropped off at Hosanna's Little Angels daycare center at 9 in the morning by their mother. The daycare workers, Lynette Richardson and Charlene Logan, would later testify that Saniyah appeared completely normal that day. This is crucial to understand. See, multiple witnesses observed Saniyah throughout that Friday, and every single one described her as playful, energetic, and her normal self. She played with other children, showing no signs of illness, and displayed no visible injuries. You see, around 2 in the afternoon, Saniyah had an accident and soiled her pants. This is important because it would later become a trigger for the violence that would end her life. When Calvin picked up Saniyah and her brothers at 5 that evening, the daycare workers reported the accident to him, which was their standard procedure. They noted that when Saniyah left their care, she had no injuries, no bruises, no marks, nothing. She wasn't having breathing problems, she wasn't cold to the touch, she hadn't vomited, and showed no signs of distress. This timeline is absolutely critical to understanding what happened next, because in the span of just a few hours, a healthy, happy 2-year-old will be transformed into a child fighting for her life. Now, what happened between 5 p.m. when Calvin picked up the children and 8 p.m. when he collected Anisha from work represents some of the most disturbing child mistreatment ever documented. You see, during these 3 hours, Calvin was the sole adult caretaker of Saniyah and her brothers, and according to Calvin's own admission, he became enraged when Saniyah had another toileting accident. And you have to understand, this is a 2-year-old child who was still learning to use the bathroom consistently. But for Calvin, this normal childhood behavior triggered a violent response. He eventually confessed to police that he held Saniyah down on the ground. He then struck her repeatedly with his open hand, his fist, and his basketball shoe. He admitted to striking her 13 to 14 times while she was unable to escape or defend herself. The medical evidence would later confirm that these weren't just silly games or light touches, but devastating touches that caused massive internal injuries. But the physical assaults was just the beginning of Saniyah's suffering. The autopsy would reveal she sustained multiple rib fractures. She had a brain injury consistent with severe head trauma, comparable to what someone might suffer in a serious car accident or major sporting injury. The most devastating injuries were internal. And now you know why I call this bastard a Teletubby. Growing up in England, Teletubby was a slur during high school. Just so you know. Saniyah's liver was lacerated from the force of the touches to her torso. Her bowel was perforated, leading to peritonitis, a life-threatening infection that occurs when bacteria from the intestines leak into the abdominal cavity. She had deep contusions on her behind from being mistreated, and bruises and abrasions covering her face, neck, and chest. Now, when Anisha got into the car after her shift, she immediately noticed something was wrong with her daughter. Saniyah was slumped over in the back seat, a stark contrast to her usual energetic demeanor. And as they drove home, Saniyah vomited on herself, prompting Anisha to ask Calvin, "Should we take her to the hospital?" This moment represents one of the several critical decision points that could have saved Saniyah's life, but Calvin, the idiot, dismissed Anisha's concern. "Oh, she's okay, she's just doing that for attention." That's what he literally said. This manipulation would prove to be a recurring theme throughout the evening, and when they arrived back home, Saniyah's condition continued to deteriorate. She walked very slowly, wasn't talking, and didn't play with her siblings as she normally would. Instead, she sat quietly beside her mother on the couch, a behavior that Anisha later described as unusual for her typically active daughter. As the evening progressed, Saniyah's symptoms became more alarming. She was breathing abnormally and felt cold. When Anisha expressed concern, Calvin suggested the child was probably dehydrated and told her to give Saniyah some juice. But then Saniyah vomited a yellow and red substance. Calvin explained it away by saying he had given her a yellow popsicle. And you notice he just could not be bothered to deal with it. He claimed she had bitten her tongue and swallowed blood. These explanations might seem plausible to a worried mother, desperate to believe her child wasn't injured, but they were calculated lies designed to prevent Anisha from seeking medical help. And he wanted to avoid hospital because then that would have exposed Calvin's abuse. Now, around 11 p.m., Anisha's cousin, Barnica Lewis, arrived to pick up her son, whom Calvin and Anisha had been watching. Lewis immediately noticed something was wrong with Saniyah. The child was cold, had a knot on her back, bruises on her face, and was having difficulty breathing. Lewis offered to watch the other children so that Calvin and Anisha could take Saniyah to the hospital. This was another moment where Saniyah's life could have been saved. Initially, Anisha seemed, yeah, of course, let's go to the hospital. But then, when she spoke to Calvin, she changed her mind. When Lewis made the offer again, this time directly to Calvin, he dismissed her concerns, saying Saniyah was just tired, she needs to lay down, she'll be okay. Lewis later testified she deferred to their judgment because, of course, they knew the girl better than she did. This is a heartbreaking example of how abusers manipulate situations to maintain control. And what Lewis did not know was that Saniyah was already dying. The peritonitis infection was spreading through her small body. Her internal injuries were causing massive trauma, and every minute without medical intervention was bringing her closer to death. After Lewis left around midnight, Calvin and Anisha put Saniyah on a pallet in their bedroom so they could keep an eye on her. But even then, Calvin's controlling behavior continued. When Saniyah moved toward the head of the bed, Calvin grabbed her up, made her get back down toward the foot of the bed. When Anisha told him not to be pulling on her like that, they then got into an argument. So around 3 a.m., Saniyah climbed into bed next to her mother, perhaps seeking comfort. After lying there for a while, Anisha told her, "Get back on the pallet, go to sleep." This would be some of the last interactions between mother and daughter. Now, 7 a.m., May 15th, Anisha woke up, noticed Saniyah wasn't on her pallet. She found her daughter lying on the floor in her son's bedroom and picked her up, thinking the child must be cold. It was then that she realized the horrible truth. Saniyah was dead. Anisha's screams brought Calvin running into the room. She called 911 while Calvin took Saniyah from her arms. Anisha ran outside, screaming something was wrong with her baby. A neighbor, who was a nurse, attempted CPR, but it was far too late. When paramedic Shannon Blake Thompson arrived on the scene, he immediately recognized that Saniyah had been dead for some time. Her body was already showing signs of rigor mortis, indicating that death had occurred hours earlier. Despite attempts to check for vital signs, she flatlined every time and she was pronounced dead at the scene. The initial response treated this as a natural death or sudden infant death syndrome, but when the medical examiner began their examination, the extent of Saniyah's injuries became apparent, and the investigation shifted from a natural death to a homicide. Dr. James Caruso, the forensic pathologist who performed Saniyah's autopsy, uncovered a horrifying catalogue of injuries. This painted a clear picture of systematic abuse culminating in a fatal beating. His findings would become the cornerstone of the prosecution's case. The external injuries were extensive. Saniyah had contusions and abrasions on her face and neck, a contusion on her forehead, and a contusion on her lower lip. This was caused by blunt force. She had a fracture to her left forearm that had resulted in a noticeable deformity, suggesting it had not been properly treated. Then there was the internal injuries. This revealed the true extent of the violence. Saniyah had suffered a brain injury that Dr. Caruso compared to what would expect from someone that had a severe concussion or head trauma performed in a motor crash. And of course, this wasn't an accident. There was some tremendous force applied to her head from an Air Jordan shoe. Saniyah had multiple rib fractures, some old, some fresh. Some ribs showed hemorrhaging around them without actual fractures, indicating repeated trauma to her chest area. The force applied to her ribs had been transmitted to her internal organs, causing a laceration to her liver. Most critically, Saniyah's bowels had been perforated, allowing bacteria to leak into her abs. Dr. Caruso explained that this condition, peritonitis, is life-threatening. It requires immediate medical attention. This is what she was suffering during those final hours. The infection would have made Saniyah ill with a toxic appearance, causing her to become lethargic and experience significant pain. The deep contusions on Saniyah's backside showed hemorrhaging in the fat tissue under the skin, confirming she had been beaten there as well. And perhaps most heartbreakingly, Dr. Caruso noted the pattern of injury suggests the force applied at a time when the child could not move freely in reaction to that force. This was consistent with Calvin's later admission that he held the girl down while striking her. There's no way she could have ran, preventing her from escaping or defending herself. Sergeant Connie Justice of the Memphis Police initially responded to what appeared to be a natural death, but as the medical evidence emerged, she shifted her investigation to homicide. On the afternoon of May 15th, she asked both Anisha and Calvin to come to the police station. The interrogation of Calvin would prove to be key to understanding what happened during those crucial hours. I did request this interrogation. They told me to bugger off. But initially, Calvin stuck to a story that painted him as a concerned caregiver dealing with a sick child. He claimed that the daycare workers had told him Saniyah was ill. She was vomiting, she had diarrhea, though this directly contradicted the daycare workers' testimony. Calvin told police that Saniyah had been fine when they arrived home and played with the other children. He claimed she was throwing up several times after dinner and that while standing over the toilet, she had acted weak, fallen, and then struck her head on the floor. She then continued to vomit. She said she was having more toilet accidents throughout the evening, which is why he was late picking up Anisha from work. Then police confronted him with all his inconsistencies, particularly with all the medical evidence, and his face began to crumble. Police pointed out that his explanation for the injuries did not match the severity and pattern of trauma. Faced with this evidence, Calvin finally told the truth. He confessed that he had become angry when Saniyah defecated on the bathroom floor, and he held her down while striking her repeatedly with his basketball shoes. He demonstrated for the officers how he did this, and admitted to doing it 13 to 14 times while she was unable to escape. He initially agreed to sign a formal written statement, but then changed his mind, perhaps realizing the full implications of his confession. But the damage was already done. His admission, combined with the medical evidence, provided prosecutors with a clear picture of what happened. So when the case went to trial, the prosecution built their case around the medical evidence, the timeline of events, and Calvin's own admission. The testimony of the daycare workers established Saniyah was perfectly fine before she went home. The medical testimony detailed all the injuries were caused by severe abuse, and perhaps most compelling was the testimony that came from Anisha herself, because despite being Saniyah's mother and potentially facing charges herself, she testified for the prosecution, providing details about the events. Her testimony revealed the pattern of abuse that had been occurring before the day she died. She described how Calvin routinely disciplined Saniyah by striking her in the chest with a belt or his shoes, and how he would sometimes accidentally touch her in the stomach. She testified Calvin had told her he whipped Saniyah after picking her up from daycare because she soiled herself. This testimony also revealed the manipulation and control Calvin exercised over the situation. Multiple witnesses described how he dismissed concerns about Saniyah's condition, preventing them from seeking medical help, and provided false explanations for her symptoms. Furthermore, Saniyah's 7-year-old brother also testified, provided heartbreaking details about his sister's final day. He said Calvin had disciplined Saniyah for soiling her pants. He described seeing her vomit in the car and noticed blood on her lip. Now, the defense attempted to portray Calvin as a peaceful, church-going man who would never harm a child. Character witnesses testified about his reputation in the community, but this testimony paled in comparison to the overwhelming evidence of his guilt. He himself took the stand, maintaining his innocence and claiming that his confession to police had been coerced. What a load of bollocks. He suggested that Anisha might have taken Saniyah outside during the night and assaulted her while he was asleep. This was a desperate attempt to shift blame. However, after deliberating on the evidence, the jury convicted Calvin of aggravated child abuse and first-degree felony murder. The trial court issued concurrent sentences of 20 years for the child abuse conviction and life in prison for the murder conviction. The conviction was based on two theories. Saniyah died during the commission of aggravated child abuse, and that she died during the commission of aggravated child neglect. The prosecution successfully argued that he not only physically abused Saniyah, but also neglected to seek medical care. He did appeal his conviction, because he's a moron, arguing there was no evidence, and that the trial court had made errors in admitting certain expert testimony. However, they dismissed his appeal. They claimed there was ample evidence of his guilt. The timeline showed after daycare, the child was fine, but when Anisha got back from work, the child was critically injured. So, that's the case of Saniyah Kuykendall. Sickening, disheartening, callous. This is the tragic story of Holly Rowe. It will make you angry, it will make you cry, but we owe it to Holly to know her story. On the 10th of September 2018, Holly, who was only 8 weeks old, died as a result of a severe head injury. This was caused by shaking or catastrophic traumatic impact inflicted by her father, Michael Rowe. Tiffany Tate was the mother of Holly. Michael himself was 30 years old at the time of Holly's birth, and he was 31 at the time of her death. He had a son named Riley from his previous relationship, of whom he had sole custody. His son was 4 years old at the time of Holly's death and lived with Michael, Tiffany, and Holly at their home in Crowborough in the United Kingdom. As for Michael's life itself, he had no previous convictions or other trouble or involvement with the police apart from one count for possession of cannabis. He did, however, admit to lying under oath in a family court proceeding in May 2019, but his upbringing isn't one of envy. His troubled family background, the years he spent in care, having passed through 14 foster homes over the course of 7 years, as well as the physical abuse that he suffered at the hands of his alcoholic father as a young child before he was taken into care. At the time, he was so badly abused that he had to be hospitalized. As a child, he was assessed as having a mixed emotional and behavioral disorder as well as learning difficulties. He claimed to have struggled with anxiety and depression and suffered from learning disabilities and difficulties with reasoning skills. Many of you may sympathize with him, perhaps as I tell you more of this story, but keep in mind that many others have suffered similar difficulties in their early life without having gone on to commit murder, much less to murder a child. He also suffered from a medical condition, ankylosing spondylitis. And I know I've butchered that name. I've no idea what it is. Why don't you guys comment and tell me? It is said it's a very painful condition from which he had suffered from some years and which is apparently incurable. As for Tiffany Tate, she was 19 years old at the time of Holly's birth. She was 20 years old at the time of her death, and Holly was her first and only child. Holly was born on the 14th of July 2018, 2 months premature by emergency cesarean section and had to be resuscitated. Her expected due date was September. Although Holly had the health difficulties one would expect of a baby born 2 months premature, she made very good progress in hospital, and after 19 days in August, Holly came home. She was a very healthy baby. A month later, sometime around midnight, 10th of September, Holly was dead. The undisputed medical evidence in this case showed that Holly died of a non-accidental head injury caused by an incident of forceful shaking, traumatic impact, or both, and that she would have been unconscious if not dead from the time of that injury. The pathology evidence showed extensive bleeding in various areas in and around her brain, spinal cord and eyes, bruises and tears both in the outer areas of and deep within her brain, and multiple rib fractures front and back. The evidence also shows that in addition to the event that took her life, she had suffered similar injuries produced by forceful shaking or traumatic impact, plus rib fractures from her rib cage being squeezed by large adult hands on at least one other and probably more than one other occasion. There was a time, perhaps a week, possibly two, before Holly's death, when Michael was alone with Holly downstairs giving her a nighttime feed. Tiffany was awakened by Holly screaming. She heard 3 loud bangs downstairs. Tiffany Tate came down to find Holly extremely distressed and, in her words, proper screaming. Michael told her to go back upstairs. The next day, Michael told Tiffany that he had been feeding Holly milk with a syringe through her nose because she was not taking her bottle. He also told Tiffany not to mention this incident to anyone. The timing of this incident was consistent with the medical evidence that Holly had suffered non-accidental injuries, consistent with forceful shaking or traumatic impact a few days or weeks before her death. On the evening of the 4th of September, Holly had been alone with Michael while he gave Holly her 6 p.m. feed. Tiffany had gone to the fish and chip shop to get dinner. She arrived home just in time to hear Holly barking like a seal, suddenly going floppy and stop breathing, while Michael immediately commencing mouth-to-mouth resuscitation. Michael claimed that she did stop breathing on that occasion and was merely choking on saliva. Despite the seriousness of this incident, neither of them sought medical attention for Holly on that occasion. Michael told Tiffany not to tell anyone because it was not that important. Muppet. Tiffany knew that Michael had told her to tell no one because he had done something wrong. She knew that something bad had happened to Holly and that she needed medical attention. And the question remained, why did Tiffany not act? She did not mention this event to her mother, nor say anything to the health visitor, or take Holly to the hospital, or simply take Holly away to stay somewhere safe. Tiffany told the court that from the 4th of September onwards, she knew her baby daughter was ill and in pain. She was often cold, pale, floppy. The court learned that Holly had suffered very painful rib fractures, and that Tiffany saw her pained reaction to being picked up and how she cried. That is bollocks. I told you guys recently my son, he fractured his arm. I knew straight away from the look on his face something was wrong. We took him to the hospital and now he's okay. How did this silly cow just ignore her baby's pains is beyond me. I don't mean ignore literally, I mean why don't you take her to the hospital, you idiot? In the trial, she could have admitted that she knew the situation was serious, that she should have done something, and that she did not take any effective steps to help Holly. But she didn't because she did not want Michael to throw her out of his house. During the trial, Michael tried to pin the blame on Tiffany even before Holly's death, when he said a number of things to the health visitor on the Friday before Holly's death that were clearly intended to create suspicion, and when he spoke to Tiffany's close friend Samantha 2 days after Holly's death, saying things to her that were also clearly intended to create suspicion that Tiffany had harmed Holly. This shameful behavior by Michael considerably enhanced his culpability. Moreover, the fact that it began before Holly's death shows that he knew he had seriously harmed Holly even before he finally took her life on September the 10th. The judge believed to the criminal standard that at or around midnight in September, when he carried Holly upstairs to her Moses basket, she was either already dead or in a coma, dying shortly afterwards. The judge also believed that Michael's original account to the police is true, that he simply went to bed at that point. Basically, he knew she was in severe pain, he just left her there and had a kip. Michael hoped, perhaps assumed, that Holly would recover from the shaking he had given her as he had previously. The judge said Michael's story about him having gone downstairs again after putting Holly in her Moses basket in order to have a smoke in the shed was another obvious and embarrassing lie, made up after he had heard the prosecution evidence at the first trial in March 2020 and clearly intended to divert suspicion to Tiffany. Michael himself was the last person to have seen Holly alive when he gave her her last feed. He pretended to the court that in contrast to Tiffany, he was a calm and experienced parent, having been a single parent to Riley. The evidence during the trial showed that while he was apparently a good father to Riley, he was no more patient than Tiffany when he had difficulties feeding Holly, and that he would get frustrated, lose his temper, and lash out. Unfortunately for baby Holly, his lashing out proved fatal. Both Michael and Tiffany each admitted telling lies on prior occasions, but Michael admitted to his lies as his were much more serious and more numerous, included lying under oath during family court. In addition, it was clear Michael told lie after lie during the trial in the Crown Court, changing and adding to his accounts of various incidents, but in particular regarding the events of the 10th of September with a view to cast suspicion on Tiffany. But his lies were clumsy and obvious, and the jury had no difficulty seeing through them. The judge told him, having heard a great deal of evidence about his family background, including the time that each of them spent in care as children, because both of them were abused as children, both Tiffany and Michael, the judge decided that he would not be assisted for the purposes of sentencing by any additional reports about either of the suspects. In Michael's case, the judge had considered the psychological report prepared by Dr. Celeste Van Rooyen in relation to him from August 2013, which, to the judge, confirmed all the child abuse. But it was also revealed that Michael, the dirty bastard, had a sex toy shed. When the police searched his house, they asked him about the items in the shed. He said they are male sex toys. When asked the name of the items, Michael said, "It's called a sleeve." The other one is the lower part of the female body. They were old sex toys I wasn't using. Michael said he kept the items in a bag along with a tube of KY jelly. They belong to me, he said. I use them for masturbation. As I said, dirty bastard. The judge told Michael in this case, under the relevant legislation, the starting point for the minimum term for his crime is 15 years. But there were a number of aggravating factors. The first is the extreme vulnerability of his victim, a premature baby who at the time of her death had only just reached the normal gestation period for a full-term baby. There was also the physical suffering that he inflicted on Holly on at least one other occasion and probably two, if not more, occasions. Holly was clearly suffering from the time she stopped breathing on the 4th of September until she died. Having been observed to be in pain, more sick than usual, cold floppy, her eyes rolling. In evidence, the jury heard that at her 6-week checkup with the GP, Holly showed that she could fix and follow with her eyes. One of the doctors who testified, Dr. Cleghorn, said eye rolling after that point was an indicator that Holly was seriously unwell. And on a side note, as you people know, I've mentioned, we just had a daughter, right? My daughter was born maybe a month ago. She's 4 weeks old now. How could you ever get angry at an infant? An infant is so helpless. You can't help but be gentle with them and hold them accordingly, feed them, etc. How could they ever annoy you to this point? What the hell? The judge went on to say, knowing what he did to his daughter, he told lie after lie to avoid responsibility and the consequences of what he had done. The judge sentenced him on the basis that he intended to cause Holly really serious harm rather than his intention to take her life, and that his assault on Holly, ending in her death, was not premeditated, Before I get to his actual sentencing, let's go back to Tiffany. She was described as having borderline learning difficulties. She had a history of having been taken into care as a young child, and the sexual abuse she suffered at different stages of her life at the hands of her half-brothers and her half-stepfather. Tiffany was seen to have been open and cooperative from the time of the police investigation to giving of evidence at trial. She admitted a couple of lies of comparatively minor significance. She did say, during the trial, that she had some issues with depression after the birth of Holly, which is not unusual for a young mother. In her version of events, she told police that Michael had been looking after Holly. She came home at 6 p.m. Holly was making a weird noise. She was told Holly was sick all over the floor and was barking like a seal. She went on to say, Michael said it's nothing. She's probably got trapped wind. He laid her down on her back and she stopped breathing. He done the mouth and nose thing and she was fine after that. I was there when she made that funny noise. He checked and done the mouth and nose thing and she was fine. Since that day, she's been a bit whingy and a bit cryy and a bit scared to bring up her wind. He only did the mouth and nose thing and she started breathing. He thought she was choking on her own sick. I called my mum and said Holly was barking like a seal. She went on to say that she described their relationship as complicated. She was worried that social services would take her baby away, or that Michael would throw her out of the house if anybody found out their baby had stopped breathing. Tiffany said, I called my friend and told her I said to Mike I hadn't because I didn't want him to chuck me out. The jury also heard that Tiffany was worried Michael would have custody of their baby if they separated. Tiffany's support worker, Sarah Beale, told the court Michael said if she left, she wouldn't be allowed to go to the funeral. She said they had an argument and he said if she moved away, she wouldn't be allowed to go to the funeral. She took it seriously and she was upset. The young mother admitted she considered acting violently against her baby in a police interview. I just said, why are you crying? What am I doing wrong? Sometimes I want to throw you across the wall, but I love you too much to do that. I was struggling. I said to her, what am I doing wrong? I'm doing the best I can. You need to help me out. Because she's a baby, she can't really help me out. Tiffany also reached out to her former partner for help. I thought he was setting me up to fail, she said. Now, in terms of the sentencing, this is exactly what the judge said. In relation to her sentencing, the judge had to regard the sentencing council guideline for the offense. He said, bearing in mind that she was being sentenced on the basis that she allowed rather than caused Holly's death. In the judge's view, her culpability falls into the medium category. Although the syringe feeding incident was itself not an incident of the type that resulted in Holly's death, and it cannot be said to the criminal standard that she observed Michael shaking Holly on that occasion or any other occasion. Tiffany nonetheless knew from that time that Michael was potentially dangerous to Holly. The judge believed had she not allowed the abuse, the baby would not have been murdered. There were no aggravating factors for the judge to consider in relation to her offense. The judge told her, I bear in mind that you have no previous criminal record. It is submitted on your behalf that although you have difficulty displaying emotion, you have demonstrated remorse by your acknowledgement during the trial that you should have done something to protect Holly. I accept that. I am also asked on your behalf to accept that due to Michael's lies, you have been tried for murder, but that charge of murder was dropped. I bear these matters in mind. I note that these proceedings have lasted for more than 2.5 years and that throughout that time you abided by your bail conditions with no breaches. In relation to each of you, Michael and Tiffany, there is a statutory surcharge that applies and that must be paid. Michael, for the murder of Holly, I sentence you to imprisonment for life. The lowest minimum term that I can impose commensurate with the seriousness of this murder before you can be considered for release is 19 years. It is important to emphasize so that you and the public can understand the position that the minimum term is just that, a minimum period that cannot be reduced in any way. After you have served that minimum term, there is no guarantee that you will be released at that time or at any time after that. It is only if the parole board decides that you are fit to be released that you will be released. In any event, if you are ever released on license, you will still be subject to this life sentence and to specific license conditions. If you breach any condition, you will be liable to be returned to prison to continue to serve this sentence. So Michael was sentenced to life with a minimum term of 19 years. Let's move on to Tiffany. The judge said, Tiffany Tate, For allowing the death of your baby daughter, Holly, the least possible sentence that I can impose, having regard to the seriousness of the offence, is one of 2 years and 9 months in prison. You will serve up to 1/2 of your sentence in custody before you are released on license. You must keep to the terms of your license and commit no further offence, or you will be liable to be recalled, and you may then serve the rest of your sentence in custody. There's no excuse for what happened, but I do think there's a theory. Given Michael's childhood, he probably only knew how to cope with anger by lashing out, right? There's no excuse. There's plenty of other people who have had similar trauma who haven't committed murder. But I'm saying in his brain, the moment Holly pissed him off, he just lashed out. And I do think the way he was raised probably played a part in this, as a coping mechanism. He did not know how to respond in any other way. Maybe. But that doesn't change the fact that he's a callous, sickening, disheartening bastard. I don't think 19 years is enough, or at least he should never be released. As for Tiffany's sentence, she said she didn't say anything because she wanted to stay in the house. She did not want to separate, or she feared Michael would take the child away. Well, what she should have done is taken the child away herself and kept the child safe. But she failed to do so because of her own selfish desires. 2 years? To be honest with you, I don't even know what her punishment should be. So why don't you comment? Why don't you tell me? Thank you for watching.